Good morning everyone. I am Dr. Pervender, Professor in Department of Orthodontics. Today I am going to teach you classification of malocclusion. In this I am going to cover introduction, history, what is the need of classification, what are the various classification systems like Angle's classification, Lister classification, Simon classifications, Bennett's classification, Eckermann and Profit classification, incisor and canine classification. These are the various classification which I am going to cover today. First of all, I am going to tell you what is the classification in this, what is the definition of malocclusion. So malocclusion is any variation or deviation from normal occlusion or a condition where there is a depart from normal relation of teeth to other teeth in the same arch and the teeth of opposing arch. This is the most accepted definition by White and Gardner. So now let's talk about the history of orthodontics. Hippocrates included crooked teeth in his 6th book of epidemics as early as 24th centuries ago. What we today call normal occlusion was described as early in 18th century by John and Hunter. So this is not something which is new. Carabelli in mid-19th century was probably the first person to describe in any systemic way the abnormal relationships of upper and lower dental arches. The term edge-to-edge bites and overbites are actually derived from the Carabelli system of classifications. Ewards Angle. In 1899, he introduces his classification of malocclusion, which is till date is most accepted form of classification. In this, he has classified malocclusion relative to the position of first molars. This classification was readily accepted by dental professionals since it brought order out of what previously had been confusion regarding dental relationship. He considered first molar as a fixed tooth. But Calvin Case criticized angle classification and introduced another modifications. So again now he has divided Angle's classification into various systems. So what Angle has did? He basically divided class 1, class 2, class 3 malocclusions. Whereas now the Calvin Case again divided class 1 into 7 subdivisions, class 2 into another 2 subdivisions, and in class 3 again into 2 subdivisions. So now all this is going history of malocclusion, classification of malocclusion, how the various people come and they have given various classifications, and then lastly Simon in 1920 put forward a craniometric classification of malocclusion. Now he said that classification can again divided into 3 planes, that is Frankfurt horizontal plane, orbital plane and mid-sagittal plane. In 1928, Simon felt strongly that the process of classification include inclined plane relationship, axial inclination of each tooth, a frontal analysis of midline deviations, possible asymmetric condylar positions is also something which is taken into account, rotations of posterior teeth, facial and skeletal considerations using facial photographs and cephalometric radiographs. So this is all about Simon classification. Now in 1969, Eckermann proposed another classification. I'm going to cover all classification in details. I'm just briefing you little history, how this classifications came into evolution. So now in 1969, Eckermann proposed a diagrammatic classification of malocclusion. In this again he has divided classification into planes. 5 planes he has divided. First is the alignment in the occlusion view. Second is the profile and the soft tissue changes. Thirdly is the transverse plane deviation. Fourthly, sagittal plane deviations. And lastly is the vertical plane deviations. Nowadays, it's almost 100 years since Angle had introduced his method of classification. Then came many modifications, but in spite of all this, Angle classification is still in use because of its simplicity in application and easy to communicate between the adjustant dentist and professionals. So why there is need of classification? Why we need to classify? What is the need? What are the important points? So these are firstly to identify identify the problem, diagnosis. Secondly, for the better treatment planning. Thirdly, recalling past difficulties with similar kind of cases. Another is for purpose of comparison. We can compare one kind of malocclusion with other type of malocclusion. Secondly, then next is the A's of references. Then is communication, and then like many malocclusion can be broadly divided into interarch or intra-arch. Then we have skeletal malocclusions. So all these are important. It is important for us to classify malocclusion for all these reasons, because of all these reasons. Types of classifications and types of malocclusion. In this we have distal inclination or distal tipping. Now these are various terms which are used for classifying malocclusion. So it is very important to understand these terms before we go into any type of classifications. So what do you mean by distal inclination, distal tipping? This refers to the conditions where the crown of the tooth is tilted or inclined distally. Now again the similar way is the mesial inclination or mesial tipping. Here also the crown, now in this the crown is tipped mesially, whereas the root is in different directions. So crown, mesial inclination or distal inclination. Now we have another term, that is lingual inclination or buccal inclination. Lingual inclination or lingual tipping is the same thing. In lingual inclination also there is an abnormal lingual or palatal tilting of the tooth. This condition is also known as retroclination, whereas buccal inclination or buccal tipping, this is also known as proclination. Now this refers to the labial or the buccal tilting of the tooth. Next is the mesial displacement. This refers to any tooth which is bodily moved in mesial direction towards the midline. So bodily movement can be described as displacement. It can be mesial, it can be distal. Distal displacement, now again bodily movement of the tooth in the distal direction. Lingual displacement, again bodily movement in lingual direction. Buccal displacement, that means the bodily tooth movement in buccal direction. Now there is another term which is known as infraversion or infraocclusion. This means there is an infra-eruption or infraocclusion of the tooth, that is the tooth has not erupted enough compared to another teeth in the arch. Supraversion or supraocclusion, that means in this the tooth has over-erupted as compared to other teeth in the arch. It is also known as supraocclusion. So supraversion or infraversion. Rotations. This term refers to the tooth movements around its long axis. The tooth is rotated. Distolingual, mesolingual rotation means the tooth is rotated in distolingual direction. Mesiolingual or distobuccal means the tooth is rotated in mesiolingual or distobuccal direction. Another term is transposition. Transposition means there is an interchange of two teeth. The two teeth has interchanged their position. Example, like first molar has changed its position for the canine and the canine comes to the position of the first molar. So these kind of malocclusions are known as transposition. It is very important to understand the meanings of these basic terms as we go into the depth of classification. So let's study about the widely accepted classification, that is the angle system of classification. It was given by Ebert Angle. He was the father of modern orthodontics. He introduced this system of classifying malocclusion in year 1899 and it is still in consideration after 100 years of its introduction. So what is the basis of angles classification? Angle classification is based on the mesiodistal relation of teeth, dental arches and jaws. According to Angle, maxillary first permanent molar is key to occlusion. He considered this teeth as a fixed anatomical point within the jaws. Based on the relationship of lower first permanent molar to upper first permanent molar, he classified various malocclusion. He basically classified class 1, class 2 and class 3 malocclusions, which have further subdivisions. So now let's study with the help of this diagram. Like we have what is normal occlusion? Normal occlusion is something when the molar is in class 1. Molar in class 1 means when the mesiobuccal cusp of upper first molar occludes in the buccal groove of the lower first permanent molar. And in the anterior teeth, there has to be no anomaly, like no spacing, no open bite, no deep bite, no rotations, everything in arch proper. Class 1 malocclusion is when the molar relationship is class 1, that is again mesiobuccal cusp of upper first molar occludes in the buccal groove of the lower molar. And in the interior tooth, there might be an open bite, deep bite, rotation, spacing, crowding, anything. But these kind of malocclusion is considered as class 1 malocclusion. Now the next is class 2 malocclusion. So what is class 2 malocclusion? Now here, the distobuccal cusp of upper first molar occludes in the buccal groove of the lower first molar. It is further subdivided into div 1 and div 2, which we are going to talk in detail in further slides. So now class 3 malocclusion, the upper first molar occludes between lower first and second permanent molar. So this is the angles classification. So let's talk about angles class 1. As we have discussed earlier, that the mesiobuccal cusp of upper first molar occludes in the buccal groove of the mandibular first permanent molar. This is known as class 1 angle relationship. Class 2 is again now in the mesiobuccal cusp of upper first permanent molar occludes in the buccal groove of the lower first permanent molar. This can be further subdivided into two, div 1 and div 2. In div 1, class 2 div 1 malocclusion, the malocclusion is characterized by proclination of upper central incisors, which in result increase the overjet. A deep incisor overbite can occur in the anterior region. A characteristic feature of this kind of malocclusion is that presence of abnormal muscle activity. The upper lip is usually hypotonic, short, and fail to form the lip seal. Whereas in class 2 div 2 cases, the classic feature of this type of malocclusion is this: the central incisors, upper central or laterals, are lingually tipped inside. They are lingually inclined, and the laterals, in this we have variations, like sometimes what happens that central incisors are tipped inside lingually and the laterals are proclined, or laterals and centrals both are tipped lingually and the canines are proclined. So these kind of relationship with molar class 2 relationship is known as class 2 div 2 malocclusion. In this patient also we usually see 100% deep bite. Deep bite means overlapping of upper central incisors completely. The upper central incisor completely overlap the lower centrals. So now the last is angles class 3 classification. This malocclusion exhibits class 3 molar relationship. Now what do you mean by class 3 molar relationship? Class 3 molar relationship is the molar relationship where the upper first molar occludes between the lower first and second molar. So now this type of classification is again divided into two types of classification, that is the true class 3 or pseudo class 3. True class 3 is basically can also be the etiology of these kind of malocclusion is because of genetic origin, and it can occur due to following causes like excessive large mandible, the size of the mandible is excessively large, or prognathic mandible, or a smaller than maxilla, the size of mandible is smaller than the size of maxilla, or retropositioned maxilla, or it can be combination of all above. Some of the features which are typically seen in true class 3 patients are the lower incisors tend to tilt lingually or they can be lingually inclined. The patient can present with a normal overjet, or usually these kind of patients may have edge to edge bites or an anterior crossbite. Bite can be edge to edge or it can be a crossbite. Crossbite means when your lower anteriors are ahead of upper anteriors. Okay. The space available for tongue is usually more, thus the tongue occupies the lower position, resulting in narrow upper arch. So these true class 3 patients also has a narrow upper arch. Mandible is abnormally placed in front position or the tongue is not positioned properly. These are various combinations which are typically seen in true class 3 patients. So now let's talk about pseudo class 3. Pseudo class 3, or it is also known as habitual or postural class 3 malocclusions. In these type of malocclusions is produced by the forward movement of the mandible during closure. So now the etiology here is there is not a deficiency in the sizes. It's because of the positioning. It is a positioning error. Patients habitually or posturally place his or her mandible forward. That's why these type of classifications occur. Now in this, some typical features are in this premature, why first of all, why these kind of malocclusion happens? This is because of premature loss of deciduous posterior. The child tends to move his mandible forward to establish the contact in the anterior teeth due to occlusal prematurities, or a child with enlarged adenoids tend to move the mandible forward in attempt to present the tongue with contacting with adenoids because of some reasons, maybe pain or something like that. That's why the child tends to position his mandible forward. Okay, so this is also can be further divided. Class 3 can also be in the form of subdivision. Now what do you understand by subdivision? Class 2 and class 3 is further divided into subdivision. Subdivision means when we have class 3 molar relationship on one side and class 1 molar relationship on other side. This can also happen, class 2 subdivision can also happen. That means class 2 molar relationship on one side and class 1 molar relationship on another side. So now, what are the drawbacks of angles classification? This system is accepted, we are using because it is simple to understand, simple to communicate, but everything has pros and cons. So let's talk about the drawbacks of angles classification. So now angles, the main problem in this classification is that he considered first molar as a fixed point in the skull, but it is not found to be. If some patient come to you and he don't have the first permanent molar, then what to do? Then what type of classification? How are you going to classify the malocclusion? So this was the major drawback of his classification. Second is this angle considered malocclusion only in anterior posterior plane. He did not talk about the transverse and the vertical planes. He's only talking about the anterior posterior relationship. Nothing is taken into account the transverse and the vertical planes. Next is the classification cannot apply if the first permanent molar is missing or extracted. Next is the classification cannot be applied to deciduous dentition. Then the classification does not differentiate between the skeletal or dental malocclusion. Another is the classification does not highlight the etiology. What is the cause? What is the cause of the malocclusion? And the lastly, individual tooth malpositions have not been taken into account by angles. So these are the major drawbacks which angle did not consider. So now, because of all these drawbacks, another classification came into existence. That is the Dewey's modification of angles classification. Now what is this system? Now he divided angles class 1 into 5 types and angles class 3 into 3 types. He further subdivided angles class 1 malocclusion into 5 further categories and angle class 3 into 3 further categories. Class 1 modification of Dewey's is type 1, type 2, type 3, type 4, type 5 is class 1. Class molar relationship in all these classification is class 1 only, but the anterior malocclusion changes. Example, class 1 type, class 1 modification of Dewey's in this type 1 is class 1 malocclusion with crowded anterior teeth. Molar relationship is class 1 only, but the anterior teeth are crowded. Type 2, class 1 malocclusion with protrusive maxillary incisors. Molars are in class 1, but the maxillary incisors are proclined. Class 3, class 1 malocclusion with anterior crossbite. Now we have an anterior crossbite with the class 1 molar relationship. Another is type 4, again class 1 molar relationship with posterior crossbite. The molar relationship is class 1 only, but the posterior teeth are in crossbite. Type 5, the permanent molar has drifted mesally due to early extraction of deciduous molar or second premolar. So these are different classification. Now they have given the modifications to angles classification. Same way, class 3 malocclusion also they have subdivided into 3, type 1, type 2 and type 3. Type 1, when the upper and the lower dental arches, when viewed separately, are in normal alignment, but when the arches are made to occlude, patient shows edge-to-edge incisor alignment or forwardly moved mandibular dental arch. So when we see the arches separately, they are perfectly alright. But when we told patient to occlude the arches, then we have a problem. Maybe in this the bite is edge to edge or mandible is placed forward, so resulting in a cross bite. In type 2, mandibular incisors are crowded and are in lingual relation to maxillary incisors. So now here the mandibular teeth are crowded and they are in lingual relation to maxillary incisors. And in type 3, maxillary incisors are crowded and are in crossbite in relation to mandibular anterior. So these are various subdivisions or modifications which are done to class 3 and class 1 angles classification to understand the malocclusion in little more depth. So another type of classification is Lister classification. So now Lister also again modifies the angles classification. This classification came into existence in 1933. Again, he has subdivided class 1, class 2 and class 3. So now he says class 1 as a neutral occlusion, class 2 as disto occlusion. He has given different names for class 1, class 2 and class 3. And class 3 as a mesio occlusion. So class 1 as a neutral occlusion, class 2 as a disto occlusion, class 3 as a mesio occlusion. So now he has added this word versions. He added bucco versions, linguo versions, mesio versions, disto versions, supro versions, trans versions. So what do you mean by these terms? Bucco versions means buccally placed tooth or group of teeth. When we talk, this tooth is bucco version or these set of teeth are bucco versions. So then we are talking about one specific tooth which is buccal version. Linguo version means palatal or lingual version. Mesio version means placed mesally. Disto version means placed distally. Supra version above from the occlusion plane. Tori version is like there is the rotations in the tooth. Trans versions means transposition. Replace like one tooth has interchanged its position with another tooth. Suppose in the position of canine there is first premolar and in the position of first premolar there is a canine. So these terms are also important to understand the further modifications of angles classification. So this is all types of classification. This is the modifications of angles classification. Now let's talk about Simon classification. What is Simon classification? Now we have a major drawback for angles classification is that he has only taken consideration of anterior-posterior view, not taken into account the vertical relationship. So in order to, there are other planes also. So now Simon has made another classification. In this he has given 3 planes. These are Frankfurt horizontal plane, orbital plane, mid-sagittal plane. Now in this classification is based on abnormal deviations of dental arches from their normal position in relation to these 3 planes. What is Frankfurt horizontal plane? In this plane, it connects from upper margin of auditory meatus to the infraorbital margin. This plane is used to classify malocclusion in vertical plane. He has given 2 terms for this to define this type of plane is attraction and abstraction. So when the dental arches or a part of it is closer than normal to Frankfurt horizontal plane, it is known as attraction. When the dental arches or a part of it is further away from the Frankfurt horizontal plane, then it is known as abstraction. So now Simon basically what has he done? He is divided into vertical, sagittal and transverse. He divided the plane, divided in 3 planes, and he has given different terms for if the malocclusion is coming closer to that plane or it is going away from that plane, if some abnormality is seen. So what what is the landmarks for orbital plane? In this plane is perpendicular to Frankfurt horizontal plane. It dropped down from the bony orbital margin directly under the pupil of eye. According to Simon, this plane should pass through the distal third of canine, and it is also called Simon law of classification canine. This plane is used to describe malocclusion in sagittal or anterior posterior. So now the Frankfurt horizontal, initially which we have talked, Frankfurt horizontal plane, it is used to describe malocclusion in vertical direction. Now orbital plane will describe the classification in sagittal direction. So now we have the Simon classification. In this also we have now again let's revise this: Frankfurt horizontal plane, orbital plane and mid sagittal plane. So we have different terms for this. Frankfurt horizontal plane, attraction and abstraction; orbital plane, protraction and retraction; mid sagittal plane, contraction and distraction. So now the drawbacks of this type of classification is the application of this clinical situations is not practically possible. So that's why this classification is not taken into account. So these are various classifications. So now let's quickly revise incisor and canine classification. As we have classifications for molars, we also have classifications for incisors and canine. In incisor also we have class 1, class 2 and class 3 classification, and again for the canine also we have class 1, class 2, class 3. So what do you understand by incisor classification? Incisor classification was given by Mills. It is a British standard classification of incisor relationship. In this class 1, the lower incisal edges occlude with or lie immediately below the cingulum plateau of upper incisors. In class 2, the lower incisal edges lie apart to the cingulum of upper centrals, and in class 3, the lower incisor edges lie anterior to the cingulum of upper central incisors. So these are incisors classification. And same class, we also have a canine classification also, class 1, class 2 and class 3. In class 1, we have the mesial margin of upper canine coincides with the dental margin of the lower canine. Whereas in class 2, distal margin of upper canine coincides with the mesial margin of the lower canine. And in class 3, mesial margin of upper canine coincides with the distal margin of the lower first premolar. So now according to all these type of classification, we are easily communicate, we can easily diagnose, we can easily plan, and once we know what type of classification patient is having. So these are various classification which is came into existence, and further we have another modifications also.